Hello, Dr. Michael Braun here, cardiologist and internist and health maintenance expert. I'm going to talk to you about one of my favorite topics, a topic that I talk to all of my patients about, and that is about vitamin D. Couple highlights about vitamin D. Number one, it's the only vitamin that your body actually makes. It takes 3 organs to actually make the active form of vitamin D. There's not one disease process, not one organ system, not anything related to health, disease prevention, and health maintenance that is not part of what vitamin D can do. The unfortunate thing is that vitamin D is deficient in most individuals. I would say upwards of 90% of people in America are vitamin D deficient. Even here where I practice in sunny South Florida, amongst my patient population, a good 80% of people that do not supplement are either have insufficient vitamin D levels or are even deficient. Couple facts before we get into the specifics. The vast majority of people that either died of COVID or had severe COVID illness were deficient in vitamin D. This year, we're seeing one of the worst influenza seasons we've seen in over a decade, and the vast majority of people that are hospitalized or die from influenza, the flu, have deficient or insufficient levels of vitamin D. So, vitamin D is the single most important supplement that anybody can take, and here are some of the reasons. As I already touched upon, your vitamin D literally runs the immune system of the body. Vitamin D is, as I like to call it, the orchestrator or the maestro of the immune system. The specifics are related to white cell production, immune cell production, and how the vitamin D is involved in every cellular function that allows your immune system to function properly. Number 2 in the list of most important, vitamin D is highly related to cancer. There is an inverse or a disproportionate number of cancer sufferers who have insufficient or deficient vitamin D. Whether it's colon cancer, pancreatic cancer, breast cancer, prostate cancer, and other solid tumors, there is a lot of evidence that looks at vitamin D insufficiency or deficiency related to those cancers. When it comes to bone and muscle health, not only do people that are insufficient with vitamin D have a lot of more bony aches and pains, but osteoporosis, osteopenia, sarcopenia, which is loss of muscle mass, are highly related to vitamin D. Vitamin D is actually responsible for calcium metabolism in the body. When the vitamin D level is low, a lot of calcium is able to be leached out of the bone and it goes to places it does not belong, like the arteries. When vitamin D is used in sufficient amounts, it actually keeps the bone mineralized and of course takes other nutrients such as magnesium and vitamin K2, but vitamin D is the primary driver of that. Insulin resistance, and diabetes are also highly related to vitamin D. It is known that people that have deficient vitamin D have a much higher risk of metabolic abnormalities, including insulin resistance, diabetes, prediabetes, and other metabolic abnormalities, even production of triglycerides, which are highly associated with vascular disease. Along those lines, vitamin D insufficient patients do have a much higher risk for hypertension, which can then lead to coronary artery disease and other vascular issues. Vitamin D is well known as a brain boosting supplement. What do I mean? There's something known as seasonal affective disorder. It used to be called wintertime depression or wintertime blues. Vitamin D is highly related to anxiety and depression. Some of it has to do with direct production of mood hormones such as serotonin and dopamine. And it also has to do with the functioning of mitochondria in the brain. When there's deficient vitamin D levels, mitochondria do not function as well, hormones are not produced, and there's a high rate of anxiety and depression. I've actually many times have gotten my patients off of anti-anxiety medications and even serotonin reuptake inhibitors that people know as things like Lexapro and Prozac simply by loading them with vitamin D, because it does the same thing but in a downstream way, where it produces those same hormones that those medications are responsible for keeping in the bloodstream. Skin disorders are very highly associated with vitamin D. People that have deficient or insufficient amounts of vitamin D have a much higher rate of psoriasis, eczema, and even just dry skin and flaky skin. So there are very few things that are not related when it comes to disease processes or syndromes that are not related to vitamin D. And people that have lower vitamin D have much more incidence of all of the above things I mentioned. So why is vitamin D insufficient and deficient in so many people? Well, a lot of it has to do historically with the development of the Industrial Revolution, where people went from being agrarian or outside farmers to going inside of factories. That's why we also see people that live in northern climates have a much higher rate of vitamin D insufficiency and deficiency, because they're not getting any sunlight, sometimes for upwards of 6 to 8 months a year when you live in a northern climate where there's no sun. You also see in patients that live, or people that live in the northern elevations, there's actually increased risk of cancers and other vitamin D deficient related illnesses and issues, again, related to getting some absorption of vitamin D and production of vitamin D from exposure to sun. Also, we become phobic or afraid of the sun due to the potential risk of skin cancer. We either stay out of the sun or we use a lot of sun protectors, which tend to decrease the ability of conversion of cholesterol, believe it or not, in the skin into the initial inactive form of vitamin D. And then, as I said earlier, it goes from the skin to the liver to the kidney, 3 organs to actually make the active form of vitamin D, being vitamin D3. Darker skinned individuals have a harder time absorbing vitamin D, which is why inherently darker skinned individuals will have lower levels of vitamin D production by way of natural means. Let's talk about what can we do other than supplementation for vitamin D. The bad news is that there are not a lot of foods that contain adequate amounts of vitamin D. Cold water fish, salmon, the smaller fishes like mackerel, herring, anchovies, and herring tend to have the most vitamin D of any food. Since the advent and high levels of what's called rickets, which is bone deformities that were occurring in the early part of the 20th century, there were fortified foods. So that's why milk, certain other products like bread are fortified with vitamin D to help do away with rickets. And it did actually help going back to the 1930s and 40s. But now the level of vitamin D, even in fortified foods, is not nearly enough to adequately replace the amount of vitamin D that's necessary for optimal health. So in summary, unfortunately, vitamin D deficiency or insufficiency could even be considered epidemic in this country, where upwards of 70 to 80% of people, possibly 90% of people worldwide. There's even been statistics showing that if everybody supplemented to a proper vitamin D level, almost 400,000 deaths of all cause would be prevented in this country alone, and millions of deaths worldwide. So, not a patient of mine is not told about the supplementing with vitamin D. Typically, between 4,000 and 5,000 international units is a level of replacement that I recommend. Some people need more. People that have more body fat will need more due to vitamin D being a fat-soluble vitamin, and it gets kind of stuck in the fat. But everybody should be measuring their vitamin D level, so your doctor can measure it. It's inexpensive. Vitamin D supplementation is pennies a pill, very inexpensive. So there's really no reason not to be able to supplement vitamin D. And many patients that go from being insufficient or deficient, once they are replaced with adequate levels of vitamin D, they will tell you their energy level is better, their brain function is better, their mood is better. And over the long course, you're going to prevent all the diseases, or many of them that we dread, such as cancer, heart disease, certain types of brain disease, bone disease. Not only has vitamin D been shown statistically to reduce disease rates that we just mentioned, but there's now a concept known as biologic aging versus chronologic age. Biologic aging can actually be measured if anybody's familiar with something called a telomere, which is a protective cap that goes on to our chromosomes. The longer this telomere is, basically the younger that we are. It has been shown that people who have adequate vitamin D levels, typically over 50 nanograms per deciliter or even higher, have much longer telomeres. So not only are people with high vitamin D levels living longer from all causes, but you're even aging slower. And biologic aging, which we're finding out now, is much more important as an indicator of longevity and wellness than is chronologic aging. So if there's one supplement that you need to take, although I believe there are others, the most important is always going to be vitamin D. I hope this helps keep you well and healthy, and look forward to seeing you on the next video.